Welcome all viewers to my new video presentation on the topic Canine distemper. Canine distemper. It's a very contagious, acute, febrile and multi-systemic viral disease. Febrile means there will be fever. In canine distemper, there will be a biphasic fever. And affected animals are mainly dog, but it also affects wild dog, fox, wolf, ferrets, raccoons and other wild animals like lamb. And the affected dogs, actually it affects all age groups. Earlier, a term old dog encephalitis was used, but it's a misnomer because this encephalitis it's mostly an acute form. Rarely, a chronic form has been noticed, especially in the old dogs. The commonly affected are the puppies, especially 2 to 6 month old puppies. The mortality will be 50%. That is, almost half of the affected dogs will die. It's non-zoonotic. It won't affect humans. And also, it not affect cats. Here you can see from among the puppy stage, that is 0 to 6 months, within that, in the range 2 to 6 months, the immunocompetence or the immunity is just in its onset, or the immune system is developing only in a slow manner. So there will be more chance for infections in this and complications in this phase in the range 2 to 6 months. About the etiological agent, it's the canine distemper virus or CDV. It's a single-stranded RNA virus and it's enveloped. Since it's enveloped, it's a very fragile virus. Even in room temperature, it will be destroyed within 4 hours. So we can use whatever disinfectant we routinely use to uh, kill the viruses. And it belongs to the family Paramyxoviridae under the genus Morbillivirus. It's the genus under which the rinderpest virus and the PPR virus belongs to. It's a pantropic virus. Pantropism means the virus has the tropism for almost all cells in the body. And among the cells, relatively show more tropism to the lymphocytes, followed by epithelial cells, followed by the neurons. Since it affects the lymphocytes, it causes severe immunosuppression. It's a highly contagious disease. Even after if the animal is recovering, the virus will be shed in the secretions. It can be 4 days or up to 1 or 2 or 3 weeks or even maximum to 4 months. And the incubation period is 3 to 7 days, but it can go up to 10 days, even rarely above that. Here you can see the envelope. Then inside that green color there is it's the single-stranded RNA. Modes of transmission. First mode, direct mode. Mainly it's through respiratory aerosols, while coughing, sneezing, etc. Then through the secretions like tear, saliva. Then excretions like feces, urine. Then indirect contact. This will be through the objects contaminated with these three. It may be during grooming, uh, unhygienic grooming, sharing of unhygienic water and food bowls, etc. Or when the dog is going towards an area contaminated with these aerosols, can even through carriers, the dog can get the infection. Maybe it may be humans or cats or even a healthy dog. And transplacental transmission. If the puppies are getting through the placenta within 6 weeks of birth, they will develop neurological signs. And through trans mammary or trans colostrum. This happens mainly in puppies less than 1 week. If they get this infection, cardiac signs will develop within 3 weeks. There will be cardiomyopathy and cardiac failure. About the pathogenesis, how it enters the lungs, mainly through respiratory aerosols. The virus multiplicates in the local lymphatic tissues in the respiratory tract. Predominantly, we know there will be alveolar macrophages or dust cells and also dendritic cells. And these two are the antigen presenting cells or APCs. And they will continue its multiplication. After the multiplication, now the virus is especially in the dendritic cells. Through the dendritic cells, it will reach the nearest lymphoid organs like tonsils and bronchial lymph nodes, which are nearby to the lungs, and multiply through the T and B lymphocytes in the lymph nodules. After the multiplication, it enters the blood. There will be primary viremia. Now the virus get inside the lymphocytes in the blood and multiply with help of it and destroy the lymphocytes. So there will be generalized immunosuppression. Now, after this primary viremia, due to this, the virus will spread to both primary and secondary lymphoid organs due to its increased number. And it will be there in thymus, bone marrow, and even in secondary lymphoid organs and tissues like spleen, lymph nodes, and mucosal associated lymphoid tissues, especially gut associated lymphoid tissues like Peyer's patches. Now, again, the virus is highly increasing in number. There will be severe lymphopenia and immunosuppression, in addition to the generalized immunosuppression which happened earlier. In that primary viremia, there will be slight fever. But here now, after the again there is an increased multiplication, the virus enters the blood. And if there is no or less humoral immunity, there will be a secondary viremia. In addition to, if there is any secondary bacterial infections, most probably there will be secondary bacterial infections, especially if the dog is not having sufficient immunity and sufficient humoral immune response. So there will be a very high fever above 103.5 degrees Celsius. Due to the secondary viremia, the virus again spread to epithelial tissues, especially to bronchial and gastrointestinal mucosas epithelial tissues, and also to mesenchymal tissues, and finally to the central nervous system. The central nervous system can be affected either along with it or just after the infection of the epithelial tissues. You can see the respiratory aerosols, it's getting into the lungs, then in the local macrophages and dendritic cells it multiplicate, then get into the nearby tonsils and bronchial lymph nodes, then through blood it reach the secondary and even primary lymphoid organs. Again from there it multiply and increase in number, get into the blood, increase in number, whereas there is a decrease in lymphocytes. Now the virus, due to its epitheliotropism, enters the new epithelial cells. If there is no sufficient immunity, there will be a secondary viremia. Then the virus is released from the apical surface of the cells. And clinical signs. Then the early signs we generally go unnoticed. There will be a low fever, which is the first stage of the biphasic fever. And there will be anorexia and mild eye inflammation. This all occur 3 to 7 days post infection or up to 10 days post infection, which is the incubation period. And there will be a second phase of biphasic fever, which occurs during the 11th or 12th day. It is due to the secondary viremia, which is complicated by secondary bacterial infection. And next, there will be hard nose and hard pad. These are the poor prognostic signs. Why it's poor prognostic sign? Because it's a sign that it is progressing towards dangerous neurological sign. And the late signs will be neurological in the advanced stages. It is highly variable. We cannot predict accurately when it will happen. It can range from 2 to 3 weeks after infection or even up to 3 months after infection. Here we can see the signs. There will be pneumonia, then enteritis. Even it can cause problems to the reproductive system, cause infertility. There will be sometimes abortion. With the lymph nodes, there will be necrosis. After that, there will be hyperkeratosis on this nasal planum and foot pad. Then finally, ocular and neurological signs will occur. About the clinical signs, early stage there will be respiratory signs. Due to rhinitis, there will be nasal discharge, watery or scanty nasal discharge. There will be sneezing, and there will be dry or unproductive cough. There won't be production of mucus. There will be dyspnea, decrease in breath frequency. Then pneumonia also can occur. Then the gastrointestinal signs are anorexia, then vomiting will be there, and diarrhea may be sometimes bloody. But this diarrhea won't be as severe as in case of canine parvovirus infection. In parvovirus, the diarrhea will be severe bloody diarrhea. But here in case, sometimes you can get blood, but it won't be much severe. And the reproductive signs, there can be abortion or stillbirth, and it can cause infertility of the dog. Also, at the early stages, you can get ocular signs also just after the respiratory signs. Due to conjunctivitis, there will be a discharge from the nose. It can be serous, that is watery, or even mucopurulent, means sometimes it can be mixed with mucus and pus, especially in the later stages. There will be keratoconjunctivitis sicca, means inflammation of the cornea conjunctiva in addition to sicca, means there will be dryness. Then there will be blepharitis, means inflammation of eyelid. There will be anterior uveitis, means inflammation of iris, which is the anterior part of uvea. Uvea means anterior chamber of. Then there will be vision loss. This is mainly due to optic neuritis. It's a complication of optic neuritis. Then going to the skin lesion. There will be nasal hyperkeratosis and digital hyperkeratosis. And both of these are called as hard nose and hard pad respectively. So sometimes we refer this canine distemper disease as hard pad disease. But actually only 40 percentage or less than 50 percentage of the cases we will get these hard pad signs. Then sometimes or rarely we will get this pustular dermatitis, or that is skin rashes. Even though it's rare, it's a good prognostic sign. We should conclude that any dog developing these signs, there is a high chance for a satisfactory recovery. And about the dental lesions, there will be enamel hypoplasia. This is due to uh, the virus which affects the amyloblast cells of the teeth. The amyloblast will be destroyed there, therefore there won't be any proper enamel deposition by the amyloblast. So there will be fittings in the teeth, there can be discoloration. Here you can see the serous ocular discharge from the eye. On the right side you can see keratoconjunctivitis sicca. There is inflammation of the cornea, there is dryness, and the conjunctiva is also slightly inflamed. Then down you can see blepharitis, the redness in the eyelids, inflammation of eyelids. Then rhinitis, diarrhea, you can see the blood stains. Always you won't get this blood stains. Then downside you can see enamel hypoplasia. You can see it's discolorated. And if you observe, you can also notice the small pittings, depressions in the teeth. Here, rarely you can get this pustular dermatitis. You can see the rashes on the skin, pustules. It's a good prognostic sign actually. It shows that the body is trying to strongly eliminate the virus from the body. So there will be negligible amount of virus persisting in the body if the dog is very healthy. So it's a good prognostic sign. And there is high chance for recovery, a satisfactory recovery, even though not to 100%. But these two signs, this nasal hyperkeratosis and distal hyperkeratosis, what we call as hard nose, hard pad, respectively, it's a dangerous or a poor prognostic sign. Soon the dog will go to the neurological signs. And in the advanced stage, it's the neurological signs. Like there will be tremors, ataxia, myoclonic seizures. These are the uh, involuntary movements. Tremors means there will be involuntary, uncoordinated, and to and fro movements. But in ataxia, it's similar to tremor, but the movement will be an very different type. That is, it will show a jerking movement. Ataxia can even come in the muscles of eye. That's the nystagmus. There will be vertical or horizontal movement of the eyeball. It can even move dorsomedially between that. Nystagmus. Nystagmus means improper eyeball movement. Then there can be myoclonic seizures. Myo means muscle, clonic means twitching. In the myoclonic seizures, we can see there will be shivering of the muscles. It lasts for only 2 or 3 seconds, unlike in ataxia. Ataxia can last for 5 or 6 seconds. This myoclonic seizures will be only for, even though for 2 or 3 seconds, it can occur in a episodic fashion. There will be chewing gum fits. Chewing gum fits means the dog will be like chewing a chewing gum in its mouth. Then there will be temporal twitching. We are keeping our hands in the forehead region, that is in the temporal region. We can get some, we will feel like some object is coming and hitting our hands. Then there will be paralysis or paralysis. Paralysis means complete weakness. Paralysis means there will be only partial weakness. Then there will be hyperesthesia, means that the dog will be showing over responsiveness to a stimuli. We are touching the dog, it will respond in a very vigorous manner. Then there will be head tilting. The dog will tilt the head towards one side. There will be head pressing also. Sometimes the dog will be pressing its head towards the harder objects like ball. Then there will be circling of head rotation. Here you can see the myoclonic seizures. This is the chewing gum fits. Fits means convulsions or seizures. It's like you feel like the dog is chewing something in its mouth. It's the chewing gum fits or myoclonic seizures. There are also other symptoms like urinary and skeletal, since it's a pantropic virus. There will be urinary incontinence sometimes. The dog can control the urination. There will be urine leakage in between. And this virus will affect the osteoblast, osteoclast, etc. And there will be improper bone formation. So bone can't give proper support to the body. So there will be polyarthritis. There will be pain due to it, and finally can lead to lameness or improper usage of legs. Then coming into lesions, there will be pneumonia. Mainly there can be interstitial pneumonia. There can also be bronchopneumonia, especially there is secondary bacterial infections. How we can differentiate this interstitial and bronchopneumonia? In interstitial pneumonia, it affects the interstitial tissues in between the alveoli. So there will be almost widespread darkened areas. But in bronchopneumonia, there will be darkened areas only in the anterior part, that is in the anterior lobe. This darkened area is due to congestion. And for the thymus, there will be atrophy, since it's will affecting the lymphocytes. So it will cause destruction of the T lymphocytes. Then there will be catarrhal enteritis. There will be excess mucus production and inflammation of the intestine. And microscopically, we can see inclusion bodies. Here there will be both intracytoplasmic and intranuclear inclusion bodies. And there will be lymphoid necrosis in the lymph nodes. And mostly there will be acute encephalomyelitis, especially in the puppies. And rarely there will be chronic encephalomyelitis, especially in the adults. If there is chronic encephalomyelitis, you can see perivascular cuffing, gitter cells, and gemstocytes. Here you can see the macroscopic or gross lesions. Here we can see in the picture interstitial pneumonia. There is throughout there will be like a rib-like impression. That are the areas of congestion. The second picture is a bronchopneumonia. You can see the anterior lobe is affected and darkened due to congestion. The third picture is the catarrhal enteritis. You can see the glistening areas there. It's due to the excessive mucus production after the inflammation of the intestine. Then microscopic lesions. It's the bronchial epithelium, the two pictures they are showing. In the cytoplasm, you can see that arrows. First picture you can see the intracytoplasmic inclusion bodies. And second picture, inside the nucleus, if you observe well, you can see the inclusion bodies, intranuclear inclusion bodies. Then second picture, you can see it's a section of lymph node, necrotized lymph node. You can see some areas of necrosis, so lymphoid necrosis. And third picture, you can see any areas of necrosis, inflammation, vacuolation, etc. It's acute encephalomyelitis. Here, rarely you can get this chronic encephalomyelitis, especially in the old dogs. If the dog acquired the infection during my earlier stage, but still it's fighting the infection with its solid immunity and developed neurological signs in the later part of its life. But such cases are very rare. In such cases, you can get this perivascular cuffing, this cuffing around the blood vessels, cuffing, cuffing of these macrophages around the blood vessels. Then you can get Malaysia. Malaysia means softening. But there will be, even though there is softening, there will be enlargement of the microglial cells after the phagocytosis of the myelin sheath. It will be called as jitter cells. If these microglial cells after phagocytosing the myelin sheath. Then you can see gemistocytes, which are the hypertrophied astrocytes or gemistocytic astrocytes. Then diagnosis, we can do diagnosis on the symptoms and lesions. Then we should also have a differential diagnosis of leptospirosis, infectious canine hepatitis, and Rocky Mountain spotted fever with this canine December. In leptospirosis, it mainly affects the kidneys, so there will be polyuria, anuria, oliguria, etc. They can be even jaundice and icterus. In infectious canine hepatitis, if you are examining the oral mucosa, you can see hyperemia and petechial hemorrhages, that is pinpoint hemorrhages on the oral mucosa. There can also be subcutaneous edema in infectious canine hepatitis. And rarely there will be, or sometimes there will be a blue eye due to hemorrhage. In Rocky Mountain spotted fever, you can get edema on the facial extremities. There can also be lymphadenopathy, polyarthritis, etc. Going into the laboratory diagnostics methods, the most preferred method is the reverse transcriptase PCR or RT-PCR. Where you can collect secretions from nose and eye, then tonsil tissues you can collect urine, and even blood can be collected to do this RT-PCR. Then we can do ELISA. It can be IgM or IgG ELISA. We can collect blood for it. Then PCR. The same as RT-PCR, we can collect nasal and ocular secretions, tonsils, urine, and even blood. And the fourth method is the CSF antibody detection. You can collect cerebrospinal fluid. And the last method, it's not much preferred. It's the immunofluorescence assay. Here in this immunofluorescence assay, we will examine for these intracytoplasmic and intranuclear inclusion bodies. But always it's not preferred. For this, we can use conjunctival scrap, urine sediment, and the Buffy coat. For the treatment, there is no specific treatment for effective treatment for this disease. Only what you can do is give the supportive care, can administer fluids, give antiemetics and antidiarrheals for the vomiting, diarrhea, respectively. You can supplement vitamins like A, B, and even vitamin C. And nebulization can be done for pneumonia. Nebulization means inhalation of uh, medicinal vapors. Then antibiotics can be used because we have discussed that there will be chance for secondary bacterial infections, especially by the bacteria like Streptococcus, Staphylococcus, then Bordetella, Bronchoseptica, etc. Then prevention and control. The best method to prevent it is the proper vaccination. You should take proper vaccination for the dogs. Then we should properly keep clean and disinfect the kennel. Then we should avoid socialization with these stray dogs and unvaccinated dogs, etc. Then there will be many risky environments where there will be contamination of these secretions, excretions, respiratory aerosols, etc. from the unhealthy dogs. So better avoid such environments. Then last but not the least, we should isolate the diseased animals if any. Thank you. Please like, share and subscribe.